A pedicle tram flap delay is a procedure performed before a pedicle tram flap to help increase the blood flow to the skin and the fat that will be transferred to the chest to reconstruct the breast. So, one of the most common complications of a pedicle tram flap is that a portion of the transferred tissue, a portion of the skin and fat from the abdominal wall, undergoes fat necrosis and or skin necrosis, and part of it essentially dies up on the chest. In order to reduce the risk of partial flap necrosis and fat necrosis of the pedicle tram flap, oftentimes I will perform a pedicled tram flap delay. What this is it involves me making most of the incisions of your abdominal donor site. So I'm going to make an oval incision on your abdomen, and I'm going to transect the deep vessels that feed the tissue from the bottom. The deep inferior epigastric vessels are going to be ligated. What this will do is it will force that tissue to be perfused and live off of the only blood vessels that it will have after the flap is transferred. So in other words, we kind of drop the blood flow to that tissue by 50 to 70% of what the final change will be, so that rather than dropping it dramatically at the time of the flap transfer, we kind of get it ready. We sort of like working out the flap to get it ready to live once it's only living off one blood flow and transferred to the chest. So that's what a pedicle tram flap delay is for. It is preparing that tissue to live on what will be the only blood flow that it will have after it is transferred. Think of it like putting up a blockade on some streets that go into a certain area. So you're gonna put up barricades and block traffic that are trying to get in and out of some area of town. And then what'll happen in the human body, unlike traffic, I guess, so maybe this is a bad analogy, but the human body is gonna increase the blood flow and the size of the blood vessels that remain feeding that tissue. And that's what we want to happen. So that is the purpose of a delay, is I'm gonna disrupt the blood flow to that area somewhat to get it ready for the transfer. And we usually need to do that at least 3 weeks before the flap transfer, but it can be done 3 to 6 months or any period of time longer than that, but a minimum of a 3-week waiting period between the delay and the pedicled flap transfer. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.